Hi, I'm Dr. Jeff Shells with Advanced Chiropractic, and today we wanted to go over a condition that some of our patients have that we can see on x-rays. And so the majority of patients that come to our office that have alignment problems in the spine, the problem is because of some type of a injury, whether it is a specific injury or something that is a cumulative effect over a period of time, which by the way is the most common one. And there's different things that can cause those injuries. There can be physical things, certainly chemical, emotional things kind of factor into that as well. But by the time the patient comes to us, we can see that they have this alignment issue, and it was something that they had developed over a period of time usually, okay? However, for some people, the problems that they have from an alignment standpoint are things that they were born with. And I wanted to go over one of those conditions today. So there's a condition called a transitional segment that affects about 6% of the population. So about 1 in every 20 people have it, and it is usually at the base of the spine. So normally, when you look at what's called the lumbar area of the spine, it's composed of 5 vertebrae, and from the back, the vertebrae have these little projections that come out to the side. They're these little bony projections that are there to hold the muscles and the ligaments and the tendons. But what can happen is it's usually this lowest vertebra, lumbar 5, that will have a problem if it's a transitional segment. What can happen is whenever you're a little bitty baby inside mom and your spine is developing, that vertebra sometimes, one side of it doesn't know if it wants to be a vertebra or part of the tailbone, so it'll form as if it was a tailbone. And a lot of times there will actually be a joint or a connection with that vertebra and the tailbone, and then on the other side, there may not be a joint with that little projection that comes off called a transverse process. And it's about 6% of the population. And for some people, they may go their whole lifetime and have that, and they don't even know they have it because for whatever reason, it's fairly stable and it doesn't really change the alignment much in the spine. However, for some people, it can be a real problem. So in this case here, we have the tailbone, but this lowest vertebra, the 5th vertebra, on the left side, it formed more like part of the tailbone, but then on the right side, it didn't, so that because of that transitional segment, that lowest vertebra is shifted off to the right. And the problem is your tailbone is the foundation of the whole spine. So if that vertebra didn't form right and it's shifted, all the vertebrae on top have to adapt to that bad alignment. So initially, this patient's spine leaned to the right. Now, if the patient was a building and it started leaning, the whole thing would lean. But your brain always wants to put your head above the base of your spine. So the spine initially leans to the right, but then it curves back. And what'll usually happen is it'll curve and it'll basically shift back and forth all the way up to the top. So a lot of times a transitional segment here, the person may have back pain, but because of that shifting, they could actually have neck pain or headaches and problems like that. It's almost like if the foundation isn't level, the crack can work its way all the way up to the top and cause a leaky roof, right? So that condition is called a transitional vertebra. We've seen quite a few over the years since we've seen thousands of patients, and 6% of the population have that. So if you know somebody with a transitional vertebra, or you know someone who has back pain and is curious to find out exactly what's causing the pain, which is why we take the x-rays, because you can't see that without getting an x-ray. But I would encourage you to have them give us a call at 778-2225, and we'd be happy to find out if we can help them. Thanks, have a great day.